Hi, I'm Dr. Watt, the healthy neurosurgeon. Today, I'd like to make something crystal clear, literally. I'm talking about the lens of your eye and cataracts. Cataracts cause loss of vision by producing opaque spots, cloudy spots in the lens of the eye, and this comes from abnormal folding and deformation of proteins that make up the lens of the eye. Worldwide, cataracts cause about 50% of all cases of blindness. That number is lower in the developed world, but it's not because we have less cataracts, it's because we have really successful cataract surgery. And nothing against ophthalmologists, but I like to avoid surgery whenever possible. The primary cause behind cataracts is something called glycation. Glycation is where sugar molecules bind to the protein that changes its structure, causes it to fold differently, and change its function. And in this case, it makes the lens cloudy so you can't see. A good example of glycation is Mom's Thanksgiving turkey. She'd put brown sugar over the turkey, pop it in the oven, it comes out and the skin is crunchy and crispy. That's the sugar molecules binding to the collagen and proteins in the skin via glycation. The same thing is happening in your eye, it just occurs more slowly at 98 degrees than it does at 450 in the oven. The eye has some other proteins called crystallins. These serve the function of trying to protect the eye and protect the proteins that make up the lens. The problem is the crystallins can become glycated also, and once they are bound with sugar, they don't function normally. And that was your last defense to protect the eye from starting to go cloudy and lose your vision. So, step 1, avoid sugar. Step 2, a supplement called carnosine has been shown to help slow the development of cataracts. We think this works by it actually serving to protect one of these proteins called alpha-crystalline. By protecting the alpha-crystalline, it lets it do its job to protect the proteins that make up the visual part of the lens itself. In patients that are already getting cloudiness, a different form of carnosine called N-acetylcarnosine seems to work in eye drops. A lot of patients report that using these eye drops will actually decrease the cloudiness and improve their vision. So if you want to avoid cataracts, number 1, avoid sugar. It's toxic, it's the problem behind a lot of things. Try to stay on a ketogenic diet. Number 2, consider oral carnosine, 500 milligrams twice a day. And number 3, if you're already getting some cloudiness, try 1% N-acetylcarnosine drops. Now, none of this is an excuse to not see your eye doctor at least annually. Nothing takes the place of seeing your ophthalmologist or a good optician on a regular basis. Don't take risks with your vision, guys. It's not brain surgery.